Good afternoon, everyone, and welcome to today's Tech Lunch and Learn on your guide to Proda, HPOS, HI Service and PCA. We are also providing a quick update on Health Direct. We thank you for joining us for this presentation that will provide an opportunity to learn some valuable tips to take back to your practice teams. My name is Angela Heathcote and I'm from Eastern Melbourne Primary Health Network. And together with my digital health colleagues from PHNs across Victoria, I'd like to thank our guest speakers for this webinar, Tara Rosero from Eastern Melbourne PHN, Ben Wallace from Gippsland PHN, Tang Nguyen from the Australian Digital Health Agency, and Jodie Hoffmeyer from Health Direct. Next slide, please, Tara. Firstly, to start today's session, I would like to start the session by acknowledging the Wurundjeri people and other people of the Kulin Nations on who our work in the community takes place. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders, past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples today and any Aboriginal and Torres Strait Islander peoples at this webinar. Please feel free to put in the chat the lands on which you are dialing in from. Next slide, please, Tara. So just some housekeeping before we move on to today's presentation, just to let you know that all attendees are on mute. We will have a Q&A session at the end of the session, so please pop your questions as we go through today's session in the Q&A box only at the bottom. And this session will be recorded and all attendees will actually be receiving a copy of this after today's session, and all questions asked will be anonymous as well. So just on to the next slide. So in today's agenda, we're going to go through Proda with the basics with Tara. Ben's going to go through the health identifiers and HPOS. Tang from the agency is going to go through PCA. Jodie's going to give us an update on Health Direct and the National Health Services Directory. And as I mentioned, we're going to go through questions at the end with any of our speakers that we have. For the outcomes for today, next slide, please, Tara. So the learning objectives from today is understanding the basics of Proda, gaining a better understanding of the functionality of HI and HPOS, understanding the benefits of registering for PCA, and identifying how PCA connects with Health Direct and the NHSD. Next slide, please, Tara. So I'm going to pass over to our first speaker for today, Tara. Thanks, Tara.
Thank you, Anne, for the introduction. Good afternoon, everyone. My name is Tara Rosero. I'm part of the Eastern Melbourne Primary Health Network. I'm a program facilitator in the digital health team and the general practice support team at MFIN. And today I'll be speaking about Proda, which I'm sure is a fan favourite for everybody. So just going into what is Proda. So Proda is an online identity verification and authentication system, which lets you securely access government online services. Oh, sorry. I've gone too far ahead of myself. And just some of the basics of Proda. I've just mentioned a couple things, what you can do in Proda, such as registering your organisation, adding staff members, delegating to staff members, linking to the HPOS service, the HI service, AIR, where you do your immunisations for patients, also where you can see your PIP and WIP programs, and also where you can go for NASH certificates. So I'll be giving a very brief rundown on a couple of those things, but not all. And I'll just move on to who's who in the zoo. So a bit of the jargon of who's the RO and the OMO and what is that. So the RO is typically the owner of a practice or the CEO if you have multiple locations in your corporate. So this person is responsible for registering the organisation and adding staff members and adding their OMO. So the OMO is the organisation maintenance officer. So that typically can be the practice manager of a practice or a senior reception staff member. And this staff member can also be responsible for adding staff members and delegating to your staff, your reception staff, admin staff, and your doctors, and adding them in Proda. So where to actually go to have a look at your organisation details. So once you've actually logged into Proda, on the top banner, there's an organisations area where you can actually see the status in which if you're active, inactive or pending, That means if you've actually registered your business in Proda. So if you're not able to see that, I'll move on in the next slide as to why that is. And the reason to go to the organisations tab in Proda would be to add or get rid of certain members if they're no longer in your practice, and to also add service provider, which would be, like I mentioned, HPOS is where you go to mention, where you'd go to add that in. So what do you do if you cannot see your organisation details? Well, you'll need to register your organisation as a seed organisation in Proda. And to do that, you'll need to have your ABN number, your ANSIC number, and your details of where you actually are located in the practice. And to do that, that actually helps you get back to the other section of adding members in the business, because if you haven't registered your organisation, you cannot do any of these actions. So this is quite a key place in which to do that. And once you have, like I mentioned, you can add the HPOO, also named the hippo, so the little hippo there on the side, the HPOO number, which will then help you connect to the other services in Proda. Moving to adding new members, so you'd still go to that same place at the top banner in the organisation section. You would actually go to where the members tab is. And if you are the RO, you will already have access to do this. Sometimes the OMO may need to be given access to do this by the RO, because if you're not seeing the add member blue button on the right image there, it means that you do not have access. So if you're not having access to add members, speak to your RO so that they can give you the correct delegation. So then you in turn have the delegation to add other members and also to delegate. So it's worthwhile noting that with adding members in your practice, whether they're doctors or staff members, that you can add them up to a maximum of 5 years. And with the delegation that you can give to those staff members, it's worthwhile noting that the delegation only lasts 1 year. So if you were in an organisation, say Dr. Smith is giving delegation to Jane Doe. Jane Doe has been given My Medicare access. Jane will only have that My Medicare access for about a year. So it's always worthwhile noting in your practice who you've delegated to and what date you delegated to them, so that the flow in your practice doesn't just stop because someone no longer has access. So moving forward to where to access the other things I mentioned, like the WIP and PIP. So first thing you do is go to the top banner of Proda, go to the services section. You would then select My Programs. And I've just highlighted a couple of areas where you can go to see those different areas, such as AIR, the WIP, the PIP. And also just put in there the health identifiers and My Health Records, that one that's a square. That is also where you would go to find your NASH certificate, where you'd also go to find who your OMO actually is in your business, and also would go to do other range of things. So that is just an area that's worthwhile noting. If you haven't seen this before, talk with your RO to give you access so that you can actually have these selections come up on your Proda. Now, I will go to say that Proda does have e-learning modules. Some of these are not the best and some of these are quite good. So that's just me being very honest, that you can actually give your staff this link, and I will send this out in the post-event email along with this recording, where you can actually go through, and it gives a slideshow step-by-step on how to do some of those things mentioned, of getting started with Proda, how to register your business and such, and it actually is quite a useful tool. And that is me done. I will pass over now to our next speaker, Ben Wallace. Sorry, Ben, I think you're on mute.
Hi all, sorry about that. I've got the pleasure of talking about the HI service. So I'll start off by talking about who here writes down the endless usernames, IDs, and passwords on a sacred piece of paper, a Word doc, or a front of your diary, and pray you've saved your passwords on your web browser. I know I do, that's for sure. And this is just for our personal life. When I first started working in healthcare, it was this, but 10 times worse. It's a headache. Now working for the PHN, I have noticed that all practice managers have this sacred list of their doctors and nurses' usernames and identifiers, Proda RA numbers, Medicare provider numbers, and APRA numbers that they update every time a new provider joins or leaves. Often it ends up being handwritten or impossible to find by anyone else from the chaos of everyday providing care. The one identifier that is often missing is the organisation and provider's healthcare identifier number. This brings us to the healthcare identifier service. It's the long forgotten foundation of the healthcare system. I hope you are as excited as I am to learn about the all-important 16 numbers. Next slide. Next slide, sorry, Tara. So what is the healthcare identifier service? Back one. So what, thank you. Have you ever wondered how My Health Record, secure messaging, e-prescribing, and Medicare work, or how the healthcare system seamlessly connects healthcare providers to each other and healthcare consumers? I know I have. The answer is the healthcare identifier, commonly known as the HI service. Now, I must warn you, there are some acronyms coming your way. The healthcare identifier, or the HI service, is a central repository that assigns unique 16-digit identifiers to individuals, the IHIs, healthcare providers, the HPIIs, and healthcare organisations, the HPIOs. These identifiers are used to link patients with their healthcare providers and their health information. This allows providers to share information securely with each other and provide patients, which can improve their quality of care to reduce duplication of services. When I first saw this image, I thought, doesn't that look like the My Medicare model of care? So next slide, Tara. So how does the HI service work behind the scenes? The HI service plays a vital role in ensuring secure communication and information sharing within the healthcare system. It verifies HPIs and IHIs and HPIOs. The HI service prevents unauthorized access to patients' information and safeguards sensitive data. This allows you to confidently share your patient's information with other healthcare providers involved in their patient's care, knowing that the information is only going to go to the authorized individuals. The HI service is used in a number of different ways to support the healthcare system. One of the most important uses of the HI service is to connect to My Health Record. And it also is used to connect secure messaging providers and the Australian Immunisation Registry, which tracks the vaccination history. And this is how the HI service is used for electronic prescribing. It allows doctors to send prescriptions to pharmacies electronically. Now, I'm sure your cybersecurity alarm bells have gone off. This is where our old friend, the NASH certificates, come in. Next slide, please. So, is the HI service secure? Now, I'm sure we all remember having to transition from NASH SHA-1s to SHA-2s. Well, the NASH, or the National Health Authentication Service for Health, is a public key infrastructure solution, or PKI. This meets the Australian government cybersecurity requirements and to ensure that health information is secure. Basically, NASH is a firewall used to access electronic prescribing, My Health Records, and secure messaging, and of course, the health identifier service. The reason for the change to SHA-2 was changes in the cybersecurity requirements to keep health information safe. Now, if you've never heard about the NASH, you're probably wondering who looks after this in your practice. And thanking them. Next slide. So who maintains this? Well, to ensure everything runs smoothly, your practice needs 2 important team members. And as Tara brought up before, those are the RO and the OMO. So the RO has the authority to register your practice with the HI service and My Health Record. They are also responsible for ensuring the organisation complies with all regulations. Now the OMO, they're the day-to-day champion of the HI service. Much like Tara discussed, this role can be filled by your practice manager or a very, very valued staff member who is a go-to for anything HPOS, or even the RO themselves. The OMO handles tasks like updating contact information, managing access permissions, troubleshooting any minor issues. This person is the one who maintains that sacred piece of paper with all of the clinical staff's HPIIs, provider numbers, and APRA numbers. One of these 2 people will be the one who adds a new healthcare provider's HPII to HPOS so they can access My Health Record through your organisation's HPIO. They also need to add it to your practice software. And this is how you can view and upload documents stored in My Health Record directly from your software. Next slide, please. This is how you access healthcare providers' access information. If you're new to HPOS, you might have realised it's not a very intuitive platform and can be a little bit difficult to navigate at times. The healthcare provider's HPII needs to be added through the healthcare identifier and My Health Record tile. Only ROs or OMOs or team members with the link service management delegation in HPOS can link HPIIs to My Health Record. The challenge can be finding the HPII if you've lost the OMO's sacred list of HPIIs. Don't worry, you're not alone. This happens all the time. And only recently it happened all at once when it came time to register for my Medicare. Just as an interesting note in my little journey of finding out all about the HI service, when a patient is enrolled in My Medicare, their regular GP shows up on My Health Record, and the HI service plays a huge role in making that happen. Okay, so now you've lost the piece of paper, or your staff member or new staff member join and you need their HPII. So how do you find it? Next slide, please. Surprisingly, if a healthcare provider does not know their HPII, it can be a painful journey to find it. Historically, there were 3 ways to find a HPII. Hoping that they kept the correspondence from APRA when they first registered. If they haven't, the OMO can try and track it down, or try and get them to track it down from the APRA website, or by calling APRA on 1300 419 495, Monday to Friday, 9 to 5. They can also call the HI service inquiry line on 1300 361 457, Monday to Friday, 8:30 to 5 p.m. And then the OMO can retrieve it from HPOS if they know how to do that. Now there is a 4th option. The ADHA realised that this was not the most streamlined or convenient process to find a HPI. They came up with a solution. They integrated the HI service into Provider Connect Australia. When you add a practitioner in Provider Connect Australia, it can retrieve their HPII and store it safely. Sorry, the acronyms are a big tongue twister, so it's a little bit hard. So next slide. So the HI service and Provider Connect. PCA is integrated into the HI service. This integration means that setting up your organization and subsites is a breeze. When you add your HPIO to PCA, it searches for the HI service on your behalf, and the information from the HI service is automatically imported and sets up your organizations and subsites. But it also adds the HPIIs to your HPIO, so no double entry. When you add a practitioner to PCA, you can also search by their name and tick a box to automatically retrieve their HPIO. I'm sure you're all thinking this sounds a lot similar than setting up the organization register and the subsites when registering for My Medicare. So how does this all look in PCA? Next slide. It's a nice little list that you can copy and paste from, of course. You have their APRA number, their HPII, and a provider number all in one spot. This is a list that can't be lost. The best thing is that anyone with a Proda account can be added to your PCA to view this information, and you don't even need to worry about what delegations in HPOS they need or have. I'm sure you're asking yourself, now that you can have a convenient system for storing HPIIs, you can't forget about the HI service. You are not that lucky. A key initiative of the Strengthening Medicare is to strengthen the HI service, of course. So what's next for the HI service? Next slide. So the future of the healthcare identifier service is, sorry, I've lost my spot. So as you know, the HI service is the foundation of the Australian healthcare system. As the healthcare system continues to modernise, the use of the HI service will be a key player. One important area is focusing on expanding the use of the HIs to other healthcare sectors, such as aged care and disability care. Previously, the HI service was restricted to APRA-registered professionals. For the expansion is that this will ensure that patients have a complete and coordinated care experience across the different sectors of the healthcare system. The accuracy and completeness of the HI service is also important, and it's historically been an issue. The Department of Health is working on ways to improve the accuracy of the data in the HI service by encouraging healthcare providers to keep their information up to date. Provider Connect Australia is the key to keeping that information up to date and being able to deliver more connected care. Well, that's all I have to say, and thank you for bearing with me, and I hope you understand a little bit more about the HI service than prior. Thank you. I'll hand over to Thang now.
Thank you, Ben. Okay, thanks, Tara. Hi, my name is Tang, and I'm the Product Manager for Directory Services at the Australian Digital Health Agency. And part of Directory Service includes Provider Connect Australia. So today's overview will be to provide you with an updated introduction and summary of what PCA is again, what it can be used for, and the value that it can provide to practices. Next slide, please, Tara. So what is Provider Connect Australia again? So Provider Connect Australia, which you might also hear as PCA for short, it's a service that is developed at the agency itself, and it's still under very active development with new features and enhancements to be rolled out on an ongoing basis to help meet the needs of stakeholders, which include practices and business partners, to support their adoption to the program and to support the increasing value of using the program in the future. So what it does is it's a service that helps connect healthcare providers to their business partners by streamlining the process healthcare providers use to register to services or to register to new business partners, and also how you send updates about your practice or about the practitioners at your practice on an ongoing basis. And part of the way you do this is to part of the way PCA does this is to allow you to maintain your information in the single source of truth, which is the PCA system. And from that single source, you then update everyone else in turn without having to reach out to every business partner manually, one by one, for each organization that you need to keep up to date. Next slide, please, Tara. So PCA is national infrastructure and is also named in the National Digital Health Strategy. So what that means is that it is here to stay, and using PCA is important to help support digital health interoperability across organizations and across different systems by keeping your practices information up to date across the healthcare sector. And part of your practice's information that you can store in PCA can include your practice's identifiers, including the identifiers of your practitioners that Ben just touched on as well. Next slide, please, Tara. So what PCA hopes to solve or to alleviate is the challenge that healthcare providers face when they need to update the information with so many business partners. So business partners are any organization that needs to know information about your practices or needs to know information about the practitioners that are working at your practice. So who works where? What does the practice, what type of practice is this? What opening hours? What hours are you open? What is your practice's contact information? And the business partners that need to receive this kind of information currently, some examples we have listed on screen, including directories such as the National Health Services Directory run by Health Direct Australia. Online booking systems need your information. Funders such as Medicare and private health insurers, of course, need your information so that they can reimburse practitioners for claims. And your local primary health network, of course, needs your information to know what kind of services are in their local catchment area. So those are some of the main examples with others listed on screen. And part of the challenge that a lot of practices face is that every time that's, say, for example, a new practitioner joins a practice, the practice manager has to reach out to each of these organizations one by one, repeat the process, sending the same information again and again. And this is where PCA can really come in to help streamline that process. Next slide, please, Tara. So this slide is an overview of how the PCA service works and how information flows from you to various different business partners. So how it works is that, first of all, to get access to the system, you log in via your Proda account. So you can visit the PCA website, it bounces you back to Proda to log in, and when you log in, we know who you are as the practice manager of that practice. Alternatively, if you don't have the PCA website handy, you can simply just log into your Proda account and then scroll down to the bottom of the page. So you'll have various tiles there. I think HPOS was one of those at the very top. If you scroll down towards the bottom as one of the newer tiles that are available, you'll find PCA in blue towards the bottom of your Proda page there. So once you've logged into Proda, you then register your organization to PCA. I'll go through a bit more detail about the registration process a bit later today. But once your organization is registered, you then add your information into PCA. So that's information about where are the practices located in your organization, what kind of healthcare services are offered at each location. For example, your location in Brisbane City might have a general practice and a dental sort of service as well. Your practice in Sydney might have a physiotherapy and an optometry only. And while you're adding information to PCA, in the center of the screen here, you can see that we have some verification services available to ensure that the information that you're adding into the system is accurate, it's up to date, and it's been validated. So some of these verification services include an integration with the Australian Business Register, so that when you're registering your organization via your ABN, we can pull in your business information straight into PCA so that you don't have to type all that in manually again. And it also gives you a way to double check that the ABN you've copied in is the correct one. We also have an integration with the HI service that, again, Ben just mentioned. So that will allow you to pull in and augment your data in PCA with all of your identifiers, including your HPIOs for your various organizations or sub-organizations if you have them, if you work for a very large healthcare provider, and also for the practitioners that work at your practice. You'll be able to pull in the HPII identifiers for those practitioners as well. And from PCA, you'll be able to communicate that across the healthcare sector. And the way PCA works is that once your information is then in PCA, you've added everything, you've completed your practice's profile, it is built on an opt-in model where you will then seek to select the business partners that you wish to publish your information to. So once you've set up everything, you might then say, I want to now publish my information to the National Health Services Directory, the NHSD. I also want to publish my information to eHealth New South Wales because I am located in New South Wales. And I also want to publish my information to, for example, Gippsland PHN because I'm located in their practice area. So you'll then select the various different business partners you want to publish information to. You'll have to agree to the business partner's terms and conditions so that each business partner, such as Gippsland PHN, will outline what they will do with your information. And once you agree to that, data then flows through to your business partners. And then in the future, if you have any changes to make to your practice's profile or to the practitioners that are working there, whether a practitioner has finished up or a new practitioner is starting soon, you'll just need to make that change in one central place, which is Provider Connect Australia, and all of your business partners will be updated automatically in turn. So that then saves you having to reach out to everyone one by one. So that's pretty much the overview slide anyway. Just next slide, please, Tara. So just to reiterate what the benefits are for healthcare providers to use PCA, including practice managers and providers themselves, is that it reduces duplication of effort. So there'll be less forms to complete. When a new practitioner has just onboarded, I know the current state is, it involves quite a few forms, especially forms to Medicare, forms to register to perhaps your secure messaging vendor and other vendors that you have to deal with. So the future state of PCA is to have all those different vendors, whether it's other government programs, other government services, and other private industry services as well, all on board so that you don't have to fill in as many forms and send as many updates manually. So because of the streamlining of the processes, it of course will save you time so that you have more time to worry about your patients, your practices, and help your practitioners deliver services to your patients. And what else can PCA do? PCA also has a feature to pre-fill online registration forms. So for some business partners that instead of having a paper form, they have an online portal, there's actually a way to launch those forms directly from PCA as a central place and have those online portals pre-filled with the information that PCA already holds, such as what's your practice name, what's your practice address, so that when it comes time to fill in that form, you just have to worry about the additional questions that aren't provided by PCA. So the aim of PCA in the future is to increase the accuracy and the completeness of healthcare service and practitioner information across the healthcare industry, which will better enable things like referrals to be sent out, reduce chances of referrals being sent in error or referrals being sent to practitioners that are no longer working there. So that's the whole aim of PCA in the future, is to support interoperability and make sure your information is up to date everywhere. Next slide, please, Tara. So this is an overview of the PCA rollout so far. So PCA first launched at the end of 2022 to the launch of our PCA pilot. So in the PCA pilot, PHNs nationwide selected some early adopter sites that they helped register to the PCA system. So we worked closely with PHNs and those early adopter sites to seek their feedback on how they found the registration process, what they want to see from the system in future, and basically any overall other feedback they had for the system. So we used that pilot to learn a lot from those PHNs that helped us and from those early adopter practices. And when we've implemented quite a few changes in PCA already to increase the value of the service and make it easier to use for everyone. So the next stage of our rollout, stage 1, at the beginning of 2023, was the start of what we call the Vaccine Clinic Finder Connect transition, which was really focused on those GPs and community pharmacies who were providing COVID vaccine services to the community. So basically that entailed the department closing an old portal called Vaccine Clinic Finder Connect, VCFC, and migrating the functionality of that into PCA. So after that migration, so of course, primarily GPs and community pharmacies were the ones providing COVID vaccination services. Those practices can now use PCA to maintain information about their COVID vaccination services, including what hours those services are available. And from PCA, that can then be published to Health Direct to then be exposed to the general public. And the next stage of the rollout, which is the stage we are currently in, which is stage 2, we've opened up the rollout so that you no longer need to be part of the pilot. You no longer need to be a COVID vaccine provider. You can now be any type of healthcare provider organization, and you can now join PCA. Right now, our focus is on allied health, and especially with regard to getting the business partners on board to support the allied health industry, and also getting further business partners on board to support GPs and pharmacies as well. Because of course, once you register to the system as a healthcare provider, the more business partners you can send your information to, the more useful the service will be. So that's the PCA rollout in terms of our adoption strategy. We have a lot of program or product rollouts, product enhancements happening recently as well. For example, last October, we just introduced the ability for healthcare practices to store and publish their banking information. And that is mainly to support our discussions with private health insurers, our discussions with perhaps Medicare and Services Australia programs, and also our discussion with work cover authorities or accident sort of insurers as well. Because if the banking information is there, that's a lot more value for them coming on board to PCA. So over to the next slide, please, Tara. Thanks for bearing with me. This is the second last one for me today. There are some common questions we receive from our users from PCA currently that I can just quickly touch on, and it might help you, prompt you to see if you have any other questions you'd like to ask that I can answer at the end of the session today. First question, how does Proda and PCA work together? I think I explained that briefly already, but basically you log into PCA via your Proda profile. So you don't need to set up a brand new PCA account at all to use this service. Next question, who can sign the participation agreement and authority documents? So to register with PCA, the agreement does have to be signed generally by a director or the owner of your organization. However, if you're the practice manager and let's say your director currently isn't working there, there's a way to easily send your director or owner a link to electronically sign that form via the PCA system. So they can dive in, provide their signature, and you can finish off the registration process separately in your own time once that's done. Next question, the nominated user no longer works here. How can we update PCA? When you register to PCA, you can set up other users to help manage the practice's profile in addition to yourself as well. So that's an important step. So once you finish registering, make sure to pop in your other practice managers and give them access to the PCA page and your other sort of receptionists that you want to help out as well. That makes sure that someone will always be available to make ongoing updates. Fourth question, is there an easy way to import organization data in PCA? Yes, Ben mentioned the way that PCA can import from the HI service, and we can. If you have organizations linked in the HI service, such as your seed organizations, etc., we can import those organizations into PCA. And also, if you are currently listed in the National Health Services Directory, there's also a way for you to import what's currently in the NHSD into PCA, touch up the information in PCA, and send those updates back to the NHSD to reflect on the online page as well. Second last question, why do I need to enter my bank account details? That is, of course, to enable those funders, especially private health insurers, Medicare, once they come on board, which still might be a few years off, and any other business partner that needs to follow that, to be able to receive your information accurately and automatically as well. However, this is completely optional in PCA. If you don't want to provide your banking information in PCA and you'd rather just continue doing that manually, that is something you may still do. It's not mandatory to use PCA. And the final question for today, or the final frequently asked question, what integration options do you currently offer with my clinical system? So what we are currently doing is we are building an integration option available to clinical systems, which can include practice management systems, such as your best practice, medical director, Genie, for example. That is coming in May this year, so in approximately 2 months' time. So through that integration option, we'll be working with various clinical systems and practice management systems to get them to synchronize their data with the PCA system. And what that means is that those, let's say, practitioners that you've added into best practice already, you'll be able to have that list of practitioners synchronized with PCA so that you don't have to add everything in PCA manually again. You can simply just go, can you please import my practitioners from best practice? I've already added them in there. Can you please have that flow through? And that is what we hope to streamline with the practice management system integration. Next slide, please, Tara. Oh yeah, that's pretty much it. So thanks everyone for your time. For more help, if you haven't registered to PCA already, we have further guidance available on our website, which is digitalhealth.gov.au/PCA. And if you need any help at all with registration or the support resources, our contact information is available on screen there with our email and our 1300 number. So that is me today. And from here, I might hand over to Jody, please.
Thanks very much, Tang. Good afternoon, everybody. My name's Jody Hoffmer. I'm the Stakeholder Manager for the NHSD here at Health Direct. So the National Health Services, next slide please, Tara. Many of you would be aware of the National Health Services Directory, I'm sure, and you've heard about it all through today's presentation. It is a comprehensive directory of health data and it is managed by Health Direct, containing 150,000 active healthcare services, which aim to provide complete, accurate and up-to-date information about Australian health services. It was established in 2012, so it's been around for a while, by the Australian Health Ministers Advisory Council, and it powers the Health Direct Service Finder, Health Direct Helplines, the mobile app and the NHSD widget. Consumers can now also book healthcare appointments directly from Service Finder and the app, for about 70% of GP services. On a second point, the Health Direct app also gives consumers access to their My Health record. The NHSD is accessed more than 2.4 million times per month, with an estimated 1 million Australians having searched the directory using Service Finder during FY23. Most of the data is provided by health services, which is complemented by other trusted data sources, including state and territory health departments, peak bodies, booking providers, and Provider Connect Australia. Organisations can access the data in NHSD through third-party websites and applications. We have data sharing agreements for organisations to access this data via API integrations and widgets. And the data is also available to approved partners for use in populating their internal directories, such as to support secure messaging, e-referrals, and discharge summaries from hospitals. Partners include state and territory health departments and software vendors such as Telstra Health. The NHSD also provides the data for Health Map, which includes geospatial information on health services and related health statistics across Australia, and this is used by both health planners, researchers, and others. Thank you, Tara. In terms of the value to the health sector, the NHSD improves consumer access to the appropriate health services, and it really plays an important role in increasing consumer health literacy. Communication between providers is streamlined, and clinical handover between services is improved, which increases efficiency and reduces clinical risk. This reduces duplication of administrative effort and resource wastage. The NHSD data contributes to health policy analysis and service needs assessments, which does drive better outcomes for Australians, and this in turn supports health policy and strategy, enabling digital health initiatives that underpin health reform. Thanks, Tara. The Australian health system is maturing its digital connectivity to improve the continuity of care between healthcare settings for the benefit of consumers and healthcare providers. Accurate and reliable information about health services is a key foundation to improving interoperability and supporting our digitally connected healthcare system. To that end, national infrastructure, referenced by Tang as well, such as healthcare identifiers, National Health Services Directory and Provider Connect Australia, is critical to achieving secure and reliable connectivity. Thank you, Tara. These four organisations, the NHSD, Provider Connect Australia, HI Service and APRA, are all part of the health interoperability environment, and they all contribute to Australia's core national infrastructure towards a digital health system. As you've heard, PCA reduces administrative burden for healthcare organisations by enabling information about their services, locations and practitioners to be entered once and published to multiple downstream partners. The HI Service is a national system that is a key enabler of interoperable health information, and of course APRA, we're all familiar with, is the directory of practitioner details that enables verification of registration status. But APRA is also the primary source for the assignment of healthcare identifiers to healthcare practitioners. Thanks, Tara. So this slide you've seen already in detail. Tang has spoken to this. We use this slide as well in our presentations, and of course it's attributable to the ADHA. But you can see that the NHSD is a key component of the downstream of information supporting consumers and healthcare organisations to ensure accurate and up-to-date information. Thank you, Tara. Next slide. So what's in it for me as a general practice? You would have heard lots of benefits over these presentations. In the NHSD, there are currently over 7,500 general practices listed. And we also run email and phone outreach campaigns to help keep the Tier 1 data, that is general practices, emergency departments, and pharmacies updated. I'm sure many of you would have had emails from us or calls from us asking us to verify your details haven't changed. We run these campaigns every 2 months for data that has not been updated within the previous 6 months. So this data is of a pretty high standard. The directory provides a trusted resource for your patients, and more importantly, through licensing and data sharing arrangements, supports and facilitates the communication of specialist reports, hospital discharge summaries, and other provider-to-provider sensitive health communications. Next slide, please, Tara. So please reach out to us with any questions. You're also able to list your practice or to update your details directly via the NHSD. However, we do recommend that you register with PCA for your data to flow through to the NHSD, as this will mean you only need to update your details in one place. And please go to our website to see more about the rest of Health Direct services and offerings. Thank you so much.
Thank you, Jodie, for that enlightening information about PCA and the National Health Service Directory and Health Direct and how it all works together. I've just put together a small workflow of how these systems all talk to each other. I'm appreciative that you guys have been sitting with us for a little while. We've given you a lot of information, so this is a very brief snapshot of how that works. So setting up your Proda, setting up your business, how that connects to the HI service, setting up your HPO numbers, how that then links to the PCA through Proda, and then how that then links with Health Direct. which in turn will all help with patient outcomes and accessing accurate and up-to-date information for when patients need to come and see you in practice. I think I'll now pass on to Ange. I think we have a couple of questions.
We do. Thanks, Tara. The Q&A has been very, very busy with lots of questions coming through. So thank you to Ben, who's actually answered some of these questions already, and actually to some of our attendees as well who have been responding to some of the questions. So thank you for the networking community that we have online. Just to let you know that as a result of all these questions that are coming through, the team have decided that what we're going to do is put together a Q&A response sheet as to these questions, because some of these will actually entail probably some instructions and links to particularly Services Australia with some of the resources that you can access to help you with some of these questions. So what we'll do is we'll pop these together as part of the package that goes out to you. And just a reminder that everybody will receive a copy of this recording as well as a copy of these slides. So just a few of the questions that haven't been answered by Ben. Ben's been very busy, but we'll pop those answers in with the questions obviously in that package. One of them is one of the practice managers is having difficulty accessing air. They've had access issues with that. So maybe we'll pop those instructions in the post sheet for us. Another question, which I think you might be able to answer, Tara, is in regards to delegating duties. How do we make sense of what these duties listed will enable? Now, I know from Services Australia, there's a document that actually provides understanding management attributes with a list of these. Isn't that right?
Yes, I'll just take that one. So with the delegation to staff, it depends on what delegation you're giving them. Some you can delegate, you can actually give them owner access, which they'll have the same access as a director. If you're only wanting them to have certain accesses, like in the example I gave before with My Medicare, you can only give them 2 accesses, so just HPOS and just My Medicare access. But whomever that person is, I'm also happy to sit with you one-on-one, regardless of which catchment you're in, and walk through that with you as well.
Thanks, Tara. And there is a Services Australia checklist that actually goes through what the attribute is and what permissions it gives as well. So we'll actually make sure that that's provided in the resource for you. So we've actually answered quite a few of these in the presentation, some of them that have come through. One of them actually did say with PCA, is there a good resource to understand this information without having a seizure? Well, we understand that there's a lot of information there. So we'll make sure that we pop some very brief, easy to read PCA resources for you in that Q&A for you. In regards to, there's a few others here just going through. Yes, and it asked, can we get some help from the PHN to assist us with PCA registration? Definitely, your PHN is here to help you. So just going on to one of the slides here, we actually do have all the information that's available from each of your PHNs that will be available, so that if you do need to reach out. Most importantly, if you actually go into our evaluation today, if you pop any requests for support in that evaluation, our team, and with your details, our team will reach out to you directly, whether it's from Eastern Melbourne PHN, Gippsland, or whatever PHN you're calling from, and they'll actually reach out to offer you that support as well. Just some of the answers that Ben has actually provided online already. Thanks, Ben. We had a question that Nash is now no longer on a CD. That's actually that you do that through your Proda account, which is correct. So that's information is there. We actually have that information available on a lot of our websites. We'll pop that in our Q&A for you. And also in regards to how GPs can actually access Proda and how to use that. There's been a suggestion there of running a session, particularly for GPs, on how do they use it and integrate that into their service. So we'll actually include that as well. So I think from the questions that we've had there, most of these have been answered by Tang and Jody already, and by Tara and Ben. So as I said, we'll pop these into a Q&A for you. Tara, just into the next slide, please. So we're actually going to start wrapping up for today. Just as I mentioned, just remembering that your PHN is here to support you in regards to if you're wanting support, there's the details online. Obviously, we'll send this out so you can access that information as we finish up. But I'd like to thank our speakers for today, Tara, Ben and Tang and Jody, for your presentations, and everyone for your attendance. We do hope that your questions were answered. Obviously, please have a look there's a link there for the QR code for our evaluation. absolutely important to put that information into that evaluation for us to follow up with you if there were any questions that were covered. And also we'll send out a link for the survey in the email that we send to you. This email will come out to you within the next week once the recording is ready. But also please make sure that you can reach out to us directly. We thank you for joining us today. We're going to let you all get back to your busy days, into your practices or where you're calling in from. Have a great afternoon, everybody, and good night. Goodbye, I should say. Good afternoon.